Very good afternoon, friends. Meeting again in the session of Materia Medica after a big gap. And today we're going to learn very small remedy from Materia Medica and from fourth year syllabus, that is Mephitis. Mephitis is the remedy from animal kingdom. It is a mammal whose anal part where the discharges are collected and from which this remedy is prepared. This remedy is a very useful remedy for the bronchitis, specifically in infants or children. I have utilized it many times where the child is not able to exhale. Asthma is there, asthmatic attack is there, and child is not able to exhale. The breathlessness is there. Many times it happens that child wakes up because of severe breathlessness, turned blue, sits up, and has a very severe spasm over there. It is the spasm of glottis specifically. It is the as if a stridor is there, as if a congestion is there in the throat, and completely it produces a very severe spasm. Many times the cyanosis can develop because of lack of oxygenation over there. And one more thing, this is not just an acute remedy. It is, yes, definitely it serves the purpose of acute immediately, but it can be used as a chronic for the chronic problems also. Mephitis, one important symptom one should not forget is related with the infantile chronic bronchitis associated with whooping cough. Many times it is a wonderful remedy for whooping cough, and that's why it should be compared with the Drosera as well as Spongia. But it has its own specific things. The specific modality is there. Child is able to inhale but child is unable to exhale. That is the characteristic with the Mephitis. So why not to learn this remedy from Boericke's Materia Medica? Wonderful remedy which has been mentioned by Boericke in short. And we'll go through the Boericke's Materia Medica. Open your Boericke's Materia Medica and see what has been said. Mephitis, it is skunk. This skunk is a mammal. This is an American mammal, and the part which is used is the anal gland. A great medicine for whooping cough. First sentence it defines the action of the remedy. Whooping cough, very dry, spasmodic, irritating cough. In order to ensure its full success, it should be given in lower dilutions from 1x to 3x. Even mother tinctures, I have used many times mother tinctures of Mephitis, and even low potency 6C, 30C, they are useful potencies in Mephitis. There is suffocative feeling, asthmatic paroxysms, spasmodic cough, and cough is so violent, seems as if each spell would terminate the life. So severe spasm. Patient becomes so severely suffered from asthma, and there is a tremendous spasm in the throat as well as in the chest, as if patient will leads towards the death. Child must be raised up, gets blue in the face, and cannot exhale. Underline this sentence. This is the sentence of Mephitis, where you can differentiate Mephitis from the rest of the remedy. Mucus rolls through upper part of the chest. Patient wants to breathe in ice cold water. There is a very specific the rolls in upper part of chest. So crepitations you can get in upper part of the chest in Mephitis. Mind excited, full of fancies, but it is not well proved remedy where you can get the mild clearly. There are many fancies, specifically fancies are always there with the children. They are always happy with the fancies. They are always looking towards the uh, TV serials where fancies are much more. Cartoon Network is famous for the children. Can neither sleep nor work because of fancies. Eyes, the pain from overexertion, the blood vision, unable to distinguish the letters. So much of blood vision and eye strain, like a ruta. This remedy is also useful for eye pain. Conjunctiva is red, eyes are hot and painful. Mouth, there are painful jerks of the in the root of the teeth. So it is painful to take, very painful, very sensitive at the root. There is blotted face and taste is coppery, as after eating the onions. Respiratory, and this is the most important part which we have to learn. What is mentioned? There are sudden contractions of glottis when drinking or talking. So this glottis goes into the spasm, and patient enters into the very severe breathless condition. And the child, specifically child, is not able to breathe. Child is not able to throw away the, or child is not able to exhale. This is very characteristic of it. The swelling and the spasm is so severe, the food goes in wrong track or wrong way. It goes enters into the trachea, and there is a continuous painful spasm. False crow cannot exhale. Cannot exhale is given in italics and it has a meaning. Spasmodic and whooping cough, few paroxysms in daytime, but many at night of after eating. So it is more aggravated at night. There is a vomiting which happens specifically because of coughing, lot of coughing, but it never ends with the vomiting. If it ends with vomiting, the cough ends in vomiting, then you must keep it in your mind, medsarium in your mind. So patient gets felt better after vomiting is typical of medsarium. Asthma, as if inhaling sulfur, cough from talking, hollow deep with rawness and hoarseness and pains through the chest. So cough is so raw, it creates a very irritating sensation, the whooping cough, and it is aggravated because of the lying down. It is getting aggravated because of the talking, and there is associated very severe chest pain. Violent spasmodic cough worse at night. So modality is very characteristic. Aggravation at night. Child feels breathless. There is a severe asthmatic attack. There is very severe spasm, and the child becomes cynosed. One must think of a Mephitis before doing anything. Sleep awakes at night with rush of blood to the lower legs. Vivid dreams of water and fire. Vivid means they are very, very clear. So, भडक मराठीत आपण भडक म्हणतो. Vivid dreams of fire and vivid dreams of water. Relationship, the comparison, Drosera, specifically for the whooping cough in Drosera, is a very important remedy from tubercular miasm, very defecting remedy, in fact. And Drosera is a remedy which should not be repeated too much. Single dose is given, you have to wait for at least 8 to 10 days. Allen has very specifically given one note under the Drosera. If you give a single dose of Drosera in epidemic of cough, whooping cough, and then you have to wait for 9 to 10 days before the you dare to repeat it. That's much deep acting remedy Drosera is there. Corallium rubrum, very typical. So it has post-nasal discharges. It has sinusitis, the frontal sinusitis, as if a cold air is entering into the those sinuses. That sensation you can get over there in Corallium rubrum. And third remedy which you mentioned over there, Sticta P. Sticta pulmonalis is a very important remedy for atrophic rhinitis. It is very typical scabs which happens to be there in the nose. These stick-tappy children, they also are suffers from the pneumonia. It is also a good remedy for bronchitis, but very specifically it is atrophic rhinitis. One should not forget. Dose first to third potency has a very short action. It has been mentioned by Boericke. And my suggestion is that this remedy one should use in 6th potency or 12th potency or 13th potency. You get a better results with this remedy. So Mephitis, a wonderful remedy for whooping cough, for chronic bronchitis, for chronic acute asthma, for spasms of glottis, larynx, and the child becomes absolutely breathless and cannot exhale. One must not forget the Mephitis. So that's all for today. We'll meet with some other remedy as time permits. Thank you.